Souderton has a preferred provider list for home care, for hospice. So Kelly's going to talk about what home care involves, the services, et cetera. It is different than a home companion or a home health aide type person. And we do they're one of our preferred providers. Also for home care, we have St. Luke's, I think Covenant. It might be just those three. I'm not sure about Southeastern, who is now Ascent. But anyway, so Kelly will tell you all about home care and Bayada and their services. And since Grandview was bought by St. Luke's, it seems a little easier sometimes dealing with some of the other companies than going through the St. Luke's system, which isn't great. But anyway, so you can know and meet our preferred providers and know what home care is.
So again, I'm Kelly Leigh. I'll kind of go through a description of what I am at Bayada as well, and then I'll circle back to that later on. So I'm a program manager, and I'm also an occupational therapist. So with Bayada, you're assigned a specific team, a same occupational physical therapist, nurse, speech therapist, and then a program manager oversees a community. So I'm assigned to certain communities, and I'm the liaison, and I meet with leadership weekly, bi-weekly, just to make sure, like I would meet with Janice, just to go over outcomes, making sure everything's going well, there's not any issues, if there needs to be any changes. And then that way, we're kind of keeping track and keeping a pulse on everything that's going on in the communities that we're in. Has anyone had home health before? Okay. No? Okay. So I'm going to kind of just go over everything that Bayada provides, our mission, everything like that. While I'm talking, though, if you have a question, anything, just let me know. So like I said, I'm an occupational therapist for about 15 years. I'm coming up on 5 years in home health. Prior to that, I was in an outpatient and hospital-based system, which is what a lot of people associate when it comes to therapy, especially if you're in independent living. You're most likely have had outpatient therapy or something like that. And I know you have an in-house provider that's outpatient therapy. So the biggest difference is with home health, that's on your Medicare A services. That's everything is 100% covered. Any equipment you may need for nursing is covered, and there's no copays. Outpatient therapy is where usually you go, and it may be more of an increased frequency, but sometimes you do have a copay or other things like that. So that's kind of just an easy description of the difference between home health, which is what we are, and outpatient or hospital-based. So we come to you, whereas the other instances you go there, right? So I'm sure they have a gym here that you go to for therapy, right? Yes. So that's the biggest difference too, is we cover everything 100% and we come to you. So, and in different communities that we're into, sometimes someone will be like, oh, I'd rather meet you in the gym. So if you have a gym here, we can also meet you there and do exercises too. But the main goal is that we're coming to you to provide any services. So our goal, we're supporting residents in living safely, independently, and confidently. Bayada's been around since 1975. We have over 50 years of healthcare experience, and it's a nonprofit. It started with just nursing care, and then over the last 50 plus years, it's evolved to add in other disciplines. So I'll briefly go through all of this, our mission and everything like that. All of these things are important, but I also think success stories and the services we provide are important as well. So again, we have our mission statement, and really the biggest thing is that we are providing 24 hours a day, 7 days a week availability. So what that looks like is if you need skilled nursing, for whatever reason, you have a wound, you just had surgery, and it's midnight, and you're like, oh, that feels hot to touch, something's not right. You just call our on-call, and our nurse calls you, and if needed be, comes out to see you. So our main mission is that we're available 24/7, and you can always get a hold of someone, because I've tested that out, and I've called different offices, and I get a call back, if not an immediate answer. So Families coping with significant illness or disability need help and support while caring for a family member. So our goal is to come out and help give that support, whether it's through therapy, nursing, a home health aide. We have social workers, which is nice as well. Our vision. So we make it possible for millions of people to experience a better quality of life in the comfort of their own home. Whether you're in independent living, personal care, if there's cottages, wherever you're living, we want you to age in place, which means we want you to stay in your home and stay there independently for as long as possible and as safe as possible. Sometimes that looks like giving modifications to your bathroom and telling you different equipment to get. So that is the benefit of home health. You're coming in and you're modifying your home so that we don't have any more falls. You don't have to go into the hospital. We try and prevent things as much as possible. Our beliefs, patient, client, people use those interchangeably, but the biggest thing is that's who comes first. I was just at a meeting at another community earlier today, and there were some issues coming up, and even our director was there, I was there, we were meeting with leadership, and he said the same thing. Even if we lost a cost of something, the most important thing is the client is happy. That's who is the priority. And working in healthcare for 15 years in different settings, I do think the culture at Bayada shows that, which is nice. And if someone isn't happy, the first thing they want to do is take care of that. Whether it's they want to set schedule or they want to call ahead of time, things like that. Our goal is to accommodate that and make sure the client is happy and they're well taken care of. The next one I like too is they believe their employees are their greatest asset. That is why I think clients are happy, because employees are happy. And Bayada's culture shows that. They're very family-friendly oriented. I have 2 kids, a 2-year-old and a 4-year-old. When they're sick, they have a school event. I've never been told no. It says take care of your family. And I think that shows in how we take care of our clients and our patients, because we care about the name that we have on our shirts, so we want you to be provided for well. We believe in building relationships and working together with other communities and caregivers. Even if we are not the only provider in a building, we make sure we have a good relationship with other providers. So we are the home health provider in a lot of facilities, and then they have an in-house provider as well. That's that outpatient therapy. We don't look at that as competition, we look at it as how to collaborate. So a lot of times, whoever the director of the rehab in that department is, I make sure I have a good relationship. And I say, hey, so-and-so is going to be discharged soon. I think they'd benefit from seeing you next for higher frequency. Or they have someone on their services and like, hey, you know what? They went out, they had pneumonia, or they had like a urinary tract infection. They're not doing so great. They can't tolerate us. Maybe you guys should start seeing them again. And having that good relationship has a continuity of care and helps people who are getting therapy. So even if we are not the only provider in a building, our goal is to make sure we maintain good relationships with anyone else in that building too. Because there is like Janice said, there's a lot of different home health care agencies, hospice agencies, outpatient providers. So staying in communication with them is really the key. So when you do any Bayada training as an employee, you go anywhere, they talk about their core values and principles. It's compassion, excellence, and reliability. Compassion is empathy, right? Understanding, being there, not just treating the individual, but getting to know them and what's important to them. Especially as an OT, I went into this profession because of something that happened to my mom. I saw how well they took care of her, and I wanted to do the same. Most of us, that is our driving factor, compassion and empathy. Excellence. We have regular trainings that we need to do to keep us up to date on the best treatments and interventions to do with individuals. And reliability. In home health, I know, you guys said no one's had home health before, but you've had it where someone says they're going to come and they don't show up, right? Unfortunately, a lot of times in home health, people are like, hey, they call the office, my nurse said she was coming today, it's 5 o'clock, she never came. So the nice thing is reliability is you're held accountable because we have a hierarchy. We have our clinicians, then you have someone like me who's checking in like, hey, did Sally come today? Is she coming? And how long is she with them? How is it going? And then above me, you have the office staff that's looking and tracking when someone came, how long are they there? You know, are they calling beforehand? And we send out surveys, satisfaction, to make sure everyone's happy. So I think one of the biggest driving factors for us that makes us successful is that reliability. So we have our home health, and then we like to call it our senior living solutions. And that's because individuals like yourselves live in a community, right? So we come directly to you, like we mentioned, on-site therapy services. So that's occupational therapy, physical therapy, speech therapy. We have skilled nursing, personal care support, and then a dedicated program manager, which is me. We do have a social worker as well if someone needs that. Most communities do have one, but in independent living, that's not always something that's there. So we do provide that if needed. So there is a full continuum of care. Wellness services, and what that is we do fitness classes in some of our provider of choices. Most communities I'm at, they get 2 times a week. We come out and we have a fitness instructor that holds fitness classes in a lot of our provider of choices. Preventative screenings. I'm the person who comes around quarterly and does big events. I did one the other month, and it was like a baseball event. I did a fun thing, brought a lot of water ice and pretzels, but also did screenings as well, check your balance. Doesn't mean you need services with us, but just identifying if there's any issues and then taking care of it before you have a fall, whether that's with us, with outpatient therapy here, or another provider. Like I said, therapy services, skilled nursing, personal care assistance, and palliative support. Bayada does not have hospice. We do palliative support, but we do work closely with other hospice companies as well. And if you may or may not know, palliative support, people like to say, and Janice, you may, is a stepping stone sometimes before someone may transition on to hospice. But either way, if someone had to go on palliative care, we are going to assist them in the next step if they need to be. So with therapy, and if anyone's ever had physical therapy, you kind of know, I always say physical therapy does balance. Occupational therapy, I am one, and someone get mad at me for saying that. I always say we're like the waist up. We like to work on upper body strengthening, fine motor stuff, dressing, bathing, using utensils correctly. So someone who may have Parkinson's disease or multiple sclerosis, you know, their fine motor goes. We're helping them to build up grips, to use utensils and help cutting and keeping them as independent as possible. Physical therapy, you know, maybe someone else, they do a Parkinson's disease and they're balanced in a shuffling gait. So then we do a special type of program like LSVT, so it's big movements, and something like speech therapy would do the same thing. Talking loud. So our goals is to give you exercises and strategies to slow down that progression. Nursing is a big one people want to know the most about, right? So our nurses come in, they do wound care, Foley's, med management, after your hospitalization, IV therapy. There's a lot of things that nurses will cover, and that they'll come out once a week, a few times a week, depending on the need. We do have personal care and companion support. What we always tell people, though, is typically this is paid out of pocket, and it has to be in 4-hour intervals. So it has to be at least 4 hours at a time for someone to come out. If you do have long-term insurance, some things are more covered than others, but that's just kind of on a case-by-case basis. But we do have personal care assistants that will come out and help with light housekeeping, you know, laundry, dishes, anything like that. And then our specialized programs. So we love to do programs, exercise classes, and screenings. We do a lot of events, which is also part of the role that I hold, is to plan and run these events. So we do fall prevention, dementia support groups. One of the communities I go to, 2 times a month, we have a dementia support group. It's a very high level, people in IL, personal care. They come, we talk, we have different topics, all types of care and support groups. Recovery after hospitalization, chronic disease management. So realistically, we find out the needs of the community, and the residents who live there, and then we try and specialize different programs for that specific community. So not every community looks the same. It really depends on the community. And do you guys do like a resident council meeting? Is that what it's called? It's always something different. So a lot of times we'll come to that or do a poll or just ask people like, hey, I do health talks every month at every one of my communities. I'll say, what do you want to learn about? Like, what's something of interest? And I'll do a health talk on that. What kind of event do you guys want? So, bless you. We try and do, something like that specific to that individual community. And I like planning events, so. So, why do people choose Bayada? It's the care in your community. So I said, before stepping into this role, I started in January. I'm from Delaware County. I live in Montgomery County now, but my community was in Delaware County. And it says care in your community. I still go out, I visit the residents of my community because as clinicians, we get very close with our residents. I bring my kids there to visit them. It's more than just an in and out kind of job. People in healthcare typically care about the people they're with. They want to help people. So you become invested. And I can say most of our clinicians, they are very caring with their community. We have a trusted care team. Like I said, there's a lot of hierarchy in a good way. There's a lot of checks and balances with Bayada to make sure things are being done and they're being done correctly. Customized programs. People like that we do the support groups, that we do health talks and things like that, exercise classes, licensed clinicians, and then helping residents age in place. I had a realtor reach out to me today through text, and she goes, oh, people are interested in your neighborhood. When are you looking to move? I said, hopefully decades from now. And I said, I want to age in place, and that's our goal for you. So even my parents, I tell them everything. When they moved into their new home, I helped my husband came in. We made everything on the first level. That's our goal. Wherever you are, we want to make you be able to stay there for as long as possible. Because this is, even just walking, I'm like, this is beautiful here. I walked in, I'm like, this is a great campus. So again, community wellness. Like I said, we do the balance screenings, fall prevention workshops. I did one of those the other month, just like exercises, ideas to help prevent any falls. Healthy aging talks, Parkinson's support group, and the exercise classes. Even us clinicians, we have to do the exercise classes, the training, so that we can even step in. I get calls all the time like, hey, I need you to help out here, and I just go and I teach an exercise class, because reliability is a big thing. Things come up, kids get sick, unfortunately, car accidents, other things, but our goal is to be as reliable as possible. Everyone has a million success stories, right? I have one up here, but I thought of one the other day. A gentleman from another community I came from, very young, had a tragic incident, living there, supposed to be a respite stay, meaning he was just going to stay 30 to 60 days. Before this, he was walking with a walker, then he was bedbound. He was getting Hoyer to transfer. From now, I just saw him 2 weeks ago, because I still cover and treat in that community on the weekends sometimes. He's walking again with a walker, and he's going to go home in 3 months. And he really attributes it to not only just us as clinicians, the exercise classes we do. Because he said even though you don't get therapy every day, he was able to supplement exercise classes as well. So doing all of that and doing the exercises is getting him back home. And that was his biggest goal. And I feel like that's the best success story, when someone gets to return to their prior level of functioning that they were at before some sort of event occurred. So realistically, how to get started, you can talk with Janice, anyone else that, and just say, I want to connect with Bayada. Janice has the information. And then what we do is we get some information, we do an evaluation, and then we start services, whether it's just under nursing or just physical therapy or just occupational therapy. The process is pretty easy, and we kind of take care of everything. Once we get your name and information, then we kind of go from there. And then if there were to be a copay or anything like that, we let you know ahead of time so you can make the decision if you wanted to move forward or not. Okay. That was a lot, I feel like, of me talking. Does anyone have questions? Or did any of it not make sense? Because that's fair too. Yeah.
Since we have all those things available here,
Mm-hmm.
why would we choose Bayada rather than
That's a good question. So a lot of times, so that's more outpatient. It's higher level, higher frequency. So a lot of times you'll go to home health after you've had a hospitalization or some sort of decline. Outpatient therapy is higher frequency, higher intensity. So realistically, home health is good for, we call it like post-acute, like a new onset of something or a change. Because then most likely you're not able to tolerate that higher level of therapy. So where you do is you start with us, we build up your tolerance again, help you get back to where you were, and then you transition to outpatient. Unfortunately, insurance doesn't provide as much as it used to, so we always tell people you should utilize all the benefits you can and make it work for you and get as much therapy as you can. And a lot of times it's using your home health benefit and then transitioning to that outpatient benefit. Some people don't need it. If you can tolerate 3 days a week of physical therapy and occupational therapy, an hour each time, and do that well, then yes, you probably are too high level for home health. However, if you're diagnosed with a new disease, right, and you need medication management or education on that, you just had knee surgery, then that's a big change. So we should be coming into your home and showing you how to transfer safely and how to do other things. So the biggest thing is if you've had a big change and you need help more so than you did before, that's when you want to have home health, because we're coming to you and making sure your environment is safe.
I didn't find that to be really clear. Just for example,
Yeah.
I had back surgery a couple of years ago.
Yes.
And they set me up with, I was with Grandview, and they had somebody coming in after care, like every other day, or, now, I wasn't given a choice. Could I have chose to have you come instead of them?
Yes, because that's another home health provider, right, Grandview? Yeah, so, and if I'm not mistaken, like Janice said, it's always your choice of who you use. Like,
Nobody ever said I had a choice. And I said to Janice, I didn't know that we had a choice here. It doesn't seem like they say you can choose A, B, or C.
I think, and correct me if I'm wrong, a lot of times too, when you're being discharged from somewhere, the referral goes out, and they may have a preferred provider from that hospital or skilled nursing, but you may know better.
Yeah, I know sometimes Grandview will automatically refer you to Grandview Home, and
Yeah.
usually the case manager sees you and offers you that or asks you what you want. I know Jefferson often, if people go to the hospital there and they're going to come home, they'll use Bayada. But you always have a choice as an individual of who you want to provide your care.
Yeah, and we've had it before too, like you said, Jefferson a lot of times refers to Bayada, but we've had people say, you know what, I don't want to use Bayada because I usually like this person. And unfortunately, I don't think, maybe some of the hospitals that may not educate us all on that enough, but you always have a choice on who you use. Insurance depending, of course. Yeah.
Yeah, and just to expound on what Kelly said, it's like if you've been in the hospital or something new and you come home and you get home care, it's skilled nursing services, it's post-acute care. Sometimes it's care instead of going to rehab or health care for a short-term rehab stay. You can come home and have home care.
Yeah. Is that better? Okay. Yeah, there's a lot. I feel like there's a lot when it comes to rehab after hospitalizations or anything else, but I think that's a good take home too. You always have a choice. Whoever you see, where you go, it's your choice who you use. Yeah. Anyone else? No? Okay. Thank you for letting me come. I appreciate it, especially on a hot day. And make sure you get some snacks and take some to go, because I can't bring this home. We eat too much chocolate, and my kids eat really poorly, so I cannot bring any more junk food home. My husband bought Lucky Charms for my 4-year-old because he saw some at his friend's house and gave my husband a sob story. And he goes, but Rowan has them. My husband bought them. He had them this morning, and he was bouncing off the walls before preschool. I was like, okay, we can't have any more sugar in the morning. Not a good thing.